A typical day for me when I'm seeing patients and families in the hospital, sometimes I'm there at 6:30 meeting with surgeons that I'm working with, trying to improve what they're doing and talking with them about their patients. Usually about 9 o'clock, we have a meeting where we're talking about what's happening in the hospital. Are we having a lot of patients? Do we need to change how our staffing is within the nurses? Every morning at 9:30, I go down to the laboratory, the microbiology laboratory, and we have all of our team members talking about so-and-so Johnny has an infection in their blood and it's Staph aureus, and we ask questions about it. It's a very interactive process. Sometimes they'll take pictures and say, here is the microscope slide of what the bacteria look like, and we look at it and we say, well, we think it's this, and then they give us answers. And it's an educational opportunity with the rest of your team. After that session, we start going to see our patients and our families. So we have usually probably about 12 or 15 families and patients that we're going to see, and we've seen them earlier. But then we're getting telephone calls from the entire state saying, we have a question. We want to know, what should we do with Johnny who has a fever? And so we're always doing that at the same time as we're walking around and seeing patients. Someone asks us a question, say, I have Sally who's here and she's had a fever for 10 days. Tell me what you think. So we go and talk with her, listen to the family, ask those questions, play that detective where you're going, so tell me, where have you traveled? What have you eaten? Tell me more about who lives at home. What vaccinations have you had? We're getting that entire story, trying to put together a picture of what could this be for this puzzle that we have for this patient and the family. And then we go back to and talk about it and think about our ideas. And then we provide advice to the team that's taking care of them, talk with the family. And then we'll see that patient on a daily basis as we figure out the problem. Sometimes it's not right away where we're like, oh, I think I know exactly what it is. And it might take us a couple of days, but it's that listening, asking, back and forth engagement where we're trying to figure out that problem and make that patient and family better. And that's what we end up doing all day and sometimes late into the nighttime. And one of the things with that kind of job and role is that I'm always thinking about my patients when I'm taking care of them. I'm in the shower in the morning going, wow, I wonder if I didn't ask that question in the right way, and maybe I should ask that, or here's a new idea. And that's what keeps me excited every day, because it's always different when I'm seeing patients and families.